This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
This episode is brought to you by Shopify. Do you have a point of sale system you can trust, or is it a real POS? You need Shopify for retail. From accepting payments to managing inventory, Shopify POS has everything you need to sell in person. Go to shopify.com/system, all lowercase, to take your retail business to the next level today. That's shopify.com/system.
This episode is brought to you by Progressive Insurance. Fiscally responsible, financial geniuses, monetary magicians. These are things people say about drivers who switch their car insurance to Progressive and save hundreds. Visit Progressive.com to see if you could save. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary, not available in all states or situations.
Man, you are one pathetic loser.
You see? Your stupid minds. Stupid!
This is not how sane people act.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola vibes dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world famous, I can't say this. Cardiff got his channel banned from YouTube.
Oh, how funny.
So I can't say his name anymore. We'll get ours banned.
No, don't do that, yeah.
Beautiful downtown Tacie City. It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred with whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
This is a show for people who have never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347-POOHEAD. Visit us on Twitter at Weird Medicine or at Dr. Scott WM. That's at Dr. Scott WM. I'm not going to call it X. It's just too weird. Yeah. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I guess I could say X, the app formerly known as Twitter. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt and act on anything you hear on this show without talking it over with your healthcare provider. Don't forget stuff.drsteve.com, stuff.drsteve.com. I promise one of these days I will... What are you doing? You know you're on camera, right?
I don't care.
What are you doing?
I'm measuring the distance between my pupils so I can get me some new glasses. Dude. For Warby Parker, yeah.
Okay,
yeah.
You're ordering them online.
Yep.
Is that cheaper that way?
A little cheaper, but they have a better selection than the local optometrist I go to.
Okay, and so you give them your prescription, and then you have to tell them that. I thought you were doing that for your VR helmet.
Oh, no.
Because, VR, if you're doing VR, it really helps to know what your pupillary distance is.
Yeah, I bet you have one of those, don't you?
Oh, yeah. Of
course. Anyway, fuck both of you. Jesus.
That's right beside my ham radio.
Lady, douchebag!
Anyway, check out stuff.drsteve.com. Check out roadie.drsteve.com. It's ROADIE stuff.drsteve.com, or go to stuff.drsteve.com and just scroll down. It's a robotic tuner. I use it all the time. And, Brian May said these bloody bastards came out with this at the end of my career. He loved it because you can use it on stage. And you can mute yourself and just pluck your strings and it will tune for you without you having to look at anything. It's pretty neat. Check out Dr. Scott's website at simplyherbals.net. And patreon.com/weirdmedicine gets first look at everything. They'll get the video recording of this show. The YouTube channel doesn't get that anymore. It gets excerpts. So the full shows are on Patreon. And patreon.com/weirdmedicine. Plus, they get first look at all of the Dr. Steve one-shots and all the Normal World stuff and any of that, things like that. My roast of the Dabbleverse is on there. If you want to hear one joke from that, hang on a second.
Carl is here. What can we say about Carl's teeth that haven't been said? I mean, stuff like his teeth are so crooked people think they're Shuli's viewer count. But let me try. Carl's teeth wander off in more weird directions than Joe Biden after a speech.
Anyway, so there you go. But you can hear all of that.
Oh, Lord.
At patreon.com/weirdmedicine. All right, and cameo.com/weirdmedicine. I will say fluid to your mama for $5, and I love doing them. I would do them for free if they would let me, but they won't. So $5 is the cheapest you can do, but cameo.com/weirdmedicine. All right, very good. Don't forget Dr. Scott's website, simplyherbals.net, simplyherbals.net, with the best CBD nasal spray in the universe.
Entire universe,
yes. And then check me out on Normal World. The next one we're doing is on the myth and facts regarding female ejaculation, a.k.a. squirting. So that was a fun one to do. It took a long time to get it right, but the science is 100%. We have the answer. I've had the answer. If you want to know the answer before that airs, just go to drsteve.com and search for female ejaculation. You'll see all the scientific studies that are there and what's real and what's a bunch of bullshit. So, all right. And so, spoiler alert, if for the people that say it's quote unquote just piss, unquote, it depends on your definition of piss. So that's really the answer. But some women do, exude a milky substance from their Skene's glands, which, if you look at them under the microscope, are analogous to the male prostate. And matter of fact, the fluid that comes from there has prostatic-specific antigen in it, which can only be found in the prostate, and therefore those people are ejaculating. Whereas some people have coital incontinence, where their bladder fills up with very dilute fluid, and then they are incontinent. And some people will have both, and that's what confuses everybody. When Dr. Fish did the study, whatever it was, he got a porn star in his office and had her squirt, and then he tested the fluid for urea or creatinine, and it was positive, and he said, well, there you go, it's just piss. Mm-hmm. Well, okay. So I did the converse thing on Anthony Cumia's show, where we had a porn star squirt, and we tested her for prostatic-specific antigen, and it was positive. So I didn't have to do the part he did, but he only did half of the thing. That only shows that some of the fluid was coming from the bladder, but it doesn't say anything about female ejaculation whatsoever. Right. So my experiment was conclusive. His was anti-scientific. So he had a bias. You okay over there?
Oh, yeah, sorry about that.
Okay.
I was trying not to sneeze.
Yeah, it's
I'm sorry.
Okay. No, that's all right. Yeah, that's what got, Tim Sabian. He didn't like me very much, and what I heard was he tried to get our show taken off the platform, and they were consolidating and doing some stuff, but I think the reason is when I first met him, he said, "Oh yeah, your medical show. Yeah, I'm the one that created Dr. Fish's show over on Howard's channel." And I said, "Yeah, I know that show's pretty boring." And he got really mad. I think he was vindictive. I guess I don't know. I liked him. He was fine. I don't know. I was just being an ass. But anyway, there you go. But we're here, and that show is not. So there you go. All right. What else you got? Tacie, you got some topics today?
Well, I certainly do.
Well, let's get to them then.
It's Tacie's time of topics. A time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
Well, hello.
Hello.
So today I'm going to let you all choose between 4 topics.
We'll take all 4, please.
Okay. Well,
okay. What are the topics? Let's
we can have anal rectal disorder day.
Okay.
Or we can talk about
why would we say no to that?
A lung cancer vaccine trial.
Ooh.
And the new COVID vaccine.
Okay. I don't care about the new COVID vaccine. How about I would like the lung cancer thing as a news story, and the other thing is just fun extracurricular. Can we do that?
Okay. Yes.
So I am interested in a lung cancer vaccine because I smoked for a long time, 3 packs a day.
Mm-hmm. About how long did you smoke, roughly? 5 years, 10 years?
No, I got, oh boy, we look at it in pack years.
Okay.
So if you smoke 1 pack a day for a year, you had 1 pack year. If you smoked 1 pack a day for 20 years, you had 20 pack years.
Okay.
I smoked 3 packs a day for probably 10 years. So that would be a 30 pack year. Yeah, 30
That's
pack
a lot.
year history. Now, I've been quit for 20 years, but when I first saw my COVID lung, the scar tissue in my COVID lung, I was convinced that, okay, here it is.
Yep.
And, that sort of Damocles still sort of hangs over my head. But anyway, so I'm very interested in this.
Okay.
By the way, everybody, quit smoking. If I can do it, I was a degenerate smoker. If I can quit and never look back, you can too.
And I wouldn't know how do you have time to smoke 60 cigarettes in a day?
Well, okay, this is what you do.
You have to work at it.
You smoke 2 before you get in the shower while you're sitting on the pot.
Gotcha.
And
so
reading
you're hotboxing them,
or whatever. Yeah, and then you're flicking between your legs. And, of course, you have all these weird marks on the glands that are actually cigarette burns. Well, that's what happens. You're flicking and, stuff like that happens.
Gosh.
And then you smoke 2 on the way to the hospital, and then you smoke 1 or 2 from the hospital to the office, and then you smoke 1 between every patient or every 2 patients. And what you do is you take your nurse, who also smokes, and make her go out with you so she can't fill the rooms up while you're outside smoking. And then, as soon as the last patient leaves, you start smoking, just chain smoking until you go to bed. Yeah.
Oh, my gosh.
Well, sitting there I used to smoke in my office.
Yeah.
Can you believe that?
You're not alone.
We used to smoke in the emergency room back in the day. And there was a cardiothoracic surgeon, I'm not going to say his name, but when I was training, now he's the guy that does the bypass surgeries on people who smoked and had high cholesterol and stuff. And he would sit in the doctor's lounge, in the surgeon's lounge, and smoke in there. Now, you can't see a cigarette within 100 feet of the hospital now. But back then, people were smoking in their rooms. I had a lady that more than one, so this isn't a HIPAA violation because there was a bunch of them that would smoke with their oxygen on. And if you get just the wrong flick of an ash or something, the whole tubing will catch on fire, and you end up with this weird hair do where it's half of it is just gone because it's scorched. Yeah. And, oxygen doesn't burn, but it makes other things burn. And that tubing is made out of rubber / plastic. It's very flammable in the presence of oxygen. So anyway, all stupid reasons. Just quit smoking.
Yep.
All right. Okay, anyway, go ahead, Tace.
Okay. A 67-year-old man has become the first person in the UK to try what doctors hope will be a revolutionary new treatment for lung cancer, a vaccine that tells the body how to fight and kill the disease.
Right.
It uses the same mRNA technology as some COVID jabs to give instructions to the immune system.
People are going to be all up in arms about
Lord.
that.
The early stage trial in which Janus Rax is taking part will check the shot is safe.
Okay.
Some 34 research sites in 7 countries, including London, hospitals, will recruit 130 patients to try it.
Okay.
The treatment should specifically target cancer cells for destruction rather than healthy ones, hopefully meaning fewer side effects.
Yeah.
It contains information about several markers found on the surface of lung cancer cells to teach the patient's immune system what to find and what to fight.
Okay. I'm in.
Hopefully, in combination with the current standard treatment, immunotherapy, and chemotherapy, we can provide an additional immune boost.
So are they giving it to people to prevent cancer, or are they giving it to them to treat cancer?
Well, I don't know.
That's what I was wondering, too. I wonder if they give it to people that they assume are going to get cancer because they're 30-packers.
Well, or are they giving it to people who have been diagnosed with cancer?
That's interesting.
Because there are some quote-unquote vaccines that you give after the... Does it say?
No, it really...
It's okay.
It's okay, yeah. It's still good news that they're working on it.
Yeah.
Yeah. I would take it.
I think it is after you get
diagnosed, and that's part of treatment.
Because it says a cancer diagnosis is very worrying, but access to groundbreaking trials alongside other innovations to diagnose and treat cancers earlier provides hope.
Okay, yeah. So it's not something I could take to prevent it. I'm looking at it here. It's a type of immunotherapy that helps treat and prevent. Oh, well, it says treat and prevent lung cancer, though. Okay, so there is Sipuleucel T. That is a vaccine that's the only one approved to treat established tumors. There's a Semafax EGF, an immunotherapy that treats non-small cell lung cancer. It's a recombinant human epidermal growth factor and a protein carrier, so that one's not an mRNA. Then BNT116, vaccine instructs the body to hunt down and kill non-small cell lung cancer cells. So this would be one for someone that's already been diagnosed. And that's by BioNTech, and it's in phase 1. That's got to be the one you're talking about, Tacie.
Okay.
And so very interesting. Yeah.
Talks about signs and symptoms of lung cancer.
Yeah.
It's the leading cause of cancer deaths worldwide.
Sure.
1.8 million in 2020.
And you wonder why, but it's really there's so much landscape in the lungs with the alveoli. They're small. I mean, they go from your rib cage to your neck, but inside there is just so much surface area.
Yes,
because the little alveoli are microscopic, and there's jillions of them, and so there's just more cells to get affected,
to get sick.
And then the lungs are sort of the first port of entry for things outside the body, other than the GI tract.
So signs and symptoms, if you have a cough that doesn't go away after a few weeks. Long-standing cough that gets worse.
That's why I don't do live events anymore.
Chest infections that keep coming back. And, of course, coughing up blood.
Yeah.
So.
All right.
Man.
Well, very good. That was a good one.
That's a good one, Dave.
Yeah, we'll keep an eye on that. Thank you.
You're 1 for 1.
Yep.
1 for 1.
What you got? Yeah, you want a bell for that? You get a
Give
bell.
thyself a bell.
Whatever.
Anal rectal disorders. Okay.
Yikes.
Yum.
Types of anal rectal disorders.
Say that 5 times.
I know. Anal or rectal abscesses, a cavity in the anus or rectum that becomes infected and filled with pus.
Yeah.
Yikes.
This can also lead to an anal fissure.
Ugh.
Which brings us to anal fissures, which are tears or cracks in the anus that result from stretching the anal canal beyond its normal capacity.
Anal fissure. That was Joey Buttafuoco's girlfriend, right? No. Okay, sorry.
Oh, that was terrible.
Oh, my God.
Poor Amy.
Anal fistula, an opening in the skin near the anus that leads into a blind pouch or may connect through a tunnel with the rectal canal.
Right.
Most anal fistulas form in reaction to an anal gland that has developed an abscess.
Yep.
Hemorrhoids.
And then they got nowhere to go, so it's trying to escape the body, and it ends up tunneling
Back
to
in.
the outside. And so this perirectal abscesses or perirectal fistulas will communicate with some part of the rectum somewhere. And you can actually take a twist tie, or not a twist tie, a cable zip tie,
yep.
And a small one, and thread them through there, and have it go through the opening that's around the rectum or the anus, and sometimes even in the butt cheek, and you can thread that in. It will come out inside the rectum. Then you direct it out of the rectum, and then you attach the zip tie, and then you start tightening it. And over several weeks, what that'll do is it'll drag that fistula tract out of the body and into the light of day, and then it'll heal up and it goes away. It's really about the only way that you can cure these things. Antibiotics very often are not successful because the bacteria are just hard to eradicate in a tunnel that's full of fecal matter. But anyway.
Gosh.
Go ahead, Tacie.
Hemorrhoids, red and swollen veins or blood vessels in the lower rectum. They can be internal or external.
Correct. Yeah. And
Do they treat internal hemorrhoids?
Yeah, sure. Yeah, if you're bleeding particularly, or if there's a bunch of them, they'll go in and they'll band them. And so basically what they're doing is they use an anoscope to dilate the anus so that you can see them. And basically it's just like a funnel with a slot in it, and you just shove it in. It just opens things up. And then you identify the hemorrhoid, and then they have this device that's got 2 tubes. One is a little bit wider, has a larger diameter than the other, and they slide over each other. And then you can take a rubber band and put it on the narrowest tube and slip it over there. Then you run a clamp, with a real long neck on it, through those tubes, and you'll grab the hemorrhoid, and then you push this tube contraption on the hemorrhoid, and then you pull back on the narrower tube, and it slides the rubber band off, and it goes around the neck of the hemorrhoid, and it kills it. And after a while, the hemorrhoid just dies, and then you just shit them out.
Yeah,
shit out.
Does it hurt?
No. Really, above what's called the dentate line, the hemorrhoids really don't hurt very much. Now, thrombosed external hemorrhoid, we've talked about quite a few times in this.
Like MFers.
Yeah, those hurt so bad. Yeah. People can't stand up straight. They can't sit down. And if they go to a primary care provider that has some clue of what the hell they're doing, they can walk out completely pain-free. And those are your most grateful patients, is people with thrombosed external hemorrhoids and people with ingrown toenails, if you know how to fix those. Because they'll come in abject pain and misery, and they'll leave feeling 100%. So basically you have to numb them up and cut an ellipse in the thrombosed hemorrhoid. And it just looks like a tick on the outside of the anus. And when you evacuate the blood after numbing it up and prepping it, of course, and all that stuff, then the pain is completely gone. And the trick then is to keep it from closing back up and reaccumulating. And you do that by putting a wick in it. And the wick can just be the corner of a 4x4 gauze. And you just shove it in there and tape their ass cheeks together, and then tell them, after 2 hours you can pull it out in the bathtub. And that very often they won't return. The big thing about hemorrhoids is just prevent the damn thing.
Yes.
You have to prevent them by eating more fibrous matter and not having to strain to get your stool out with these giant, hard American stools from our lovely American diet.
And that's the same thing for the anal fissures.
Correct.
The fissures, when the skin stretches and you get those micro tears in there, it's just like any other tear in your skin. It hurts like crazy.
Yeah.
And
oh yeah. If you never think about your asshole until it's got a fissure in it, and then that's all you can think about.
Oh God! Yeah. And every time you go to have a bowel movement, that thing rips open again. Yes. And like
they'll use
said,
nitroglycerin. Yeah. On to just relax it. They'll use Botox too. And you would think, God, if I just Botox my ass. I'm just going to be, dropping loads everywhere. But what it does is it keeps the sphincter from spasming, and it reduces the pain and then allows it to heal up.
Yeah. But the key is, again, prevention.
Yeah. And if you can't
stay hydrated, stay hydrated.
And if you can't eat enough fiber to keep your bowels normal, then Citracel is a great fiber supplement. It's the only one I recommend because it doesn't cause the bacteria in your gut to produce gas, so it's not flatulent, or, flatulogenic. I just made that up. It might be a real word.
It might be a real word. Sounds right.
Yeah, it's not flatulogenic, but the inulin, the chicory fiber, that's the one that dissolves in water and it's clear, and it is fiber, but the bacteria in your gut and the yeast love it, and you will produce so much gas.
It blows up.
So anyway, yeah, lots of fiber. Keep those stools nice and
soft,
nice and fluffy.
Yes.
But if you're doing a lot of fiber and nothing's working, you might be creating a brick in your gut.
That's true, because maybe you're not drinking enough water, though.
Yeah.
You have to really stay well hydrated. Tacie's 100% correct. Probably deserves a bell for that.
For God's sake.
Oh, well, it's true. Because people will take this advice and go, oh, God, I got worse. But like Dr. Scott used to say, it's like if you got a bunch of sticks in a stream and you
got a beaver dam.
You end up with a beaver dam, right? So you've got to have plenty of fluid in the body so that the colon isn't trying to take fluid out of this fibrous mass, because that's the only job that the colon has, really. The main job is to reclaim water from the stool. And when you are not hydrated enough, you end up with dry stools, and you can end up with a block of citracel, methylcellulose in your gut. But anyway, very good.
Good one.
Fecal incontinence, also known as bowel incontinence. Fecal incontinence is the lack of control over your bowel movements.
Yikes.
Yeah. Now, there are some kids that people think have that, but they don't. They're constantly soiling their underwear, and sometimes they'll just turd in their underwear, and these are kids that should be long potty trained. If your kid is doing that, quit berating them. They have a thing called encopresis, and they literally can't help it, but it can be completely cured. We had a kid that had it, and that's when I learned more about it than I cared to know. But the trick is that what's happening with those kids is that they're holding it, probably at school,
right? And
they don't want to go to the bathroom, so they hold it. And if you hold your stool in long enough, the feeling will go away. Lady Diagnosis talked about that in here. And the feeling will go away, and if you do it enough, it will go away completely, and you'll never feel like you have to move your bowels until your colon is fully full, and it just contracts. So when that happens, then they have these giant bowel movements, but their colon is full of stool, so it's being pushed out, but it's gradually, so they're just constantly soiling their underwear or, having accidents and stuff like that. So the trick is to completely decompress the bowel. And to do that, you have to clean them out. So you give them, you give them an enema if they need it.
Okay.
We'll use a bowel prep. Sometimes you can use mineral oil, and you keep giving them mineral oil until they're actually leaking oil, and then you know that their bowel is clear. But in the age now, that was old school. That was like in the 80s. In the age of polyethylene glycol or Miralax, you can give somebody a bowel prep. Don't do this on your own. Do this with a pediatric gastroenterologist or your primary care. But you can get a kid's bowel cleaned out really well. You got to pick a Saturday, start early in the morning, and you're going to be doing it all day. But once they're done, now you have to do whatever you can to prevent them from holding it anymore. And one way to do that is to keep their stool pretty loose. And maybe those kids need a half a scoop of Miralax a day or whatever, the primary care. What you don't want to use is stimulant laxatives on a kid. On and on and on. It's okay every once in a while, but if you use them every day, then what's going to happen is they're going to get dependent on it. I've had people before that had to take 12 Dulcolax every day, or they couldn't ever move their bowels because they were so dependent on them. So anyway, encopresis, if your kid has encopresis, go to a website. It's called You Can Poop Too, and it's the letter U and then can poop, TOO. eBay.com, and there's a whole program there. Or just Google encaprices. There's tons of YouTube videos about it, about the protocol. There's just a standardized protocol. Every kid can be cured of this unless they have some pathologic problem in their colon, in which case they need to see a pediatric gastroenterologist. Anyway, I had a guy when I was in Boy Scout camp, and he had this, and everybody just called him, I don't remember, Georgie, poopy pants or whatever. And it was unfortunate because nobody knew what it was. I remember swimming with him in the lake, and then a turd just floated by me, and I looked at him. I was like, dude,
for goodness sakes.
And he just had that look on his face, like, what are you going to do?
Sorry. Oh my God.
Yeah, it was bad. That poor kid. And, I'm sure his parents were completely frustrated with him. They just didn't know what it was. Just like, at that time I had ADHD. My parents were frustrated with me because
that time
I would dick around and do terrible in school and then get 99th percentile on the standardized exams. And they just, were like, what the hell? But we didn't know what ADHD was back then.
Right.
I was just an underachiever. I was stupid Steve.
Yeah.
And I had to
they didn't pay attention in class and was always doing crazy stuff. Yeah.
And I had to overcome that on my own.
Yeah.
I had to, and those tools that I use to do that probably don't always serve me well in my life. But it's just I had to do something. I had to get over it.
eBay Motors is here for the ride. With over 122 million parts, you can make sure your number one ride or die stays running smoothly. Brake kits, LED headlights, bumpers, whatever your baby needs, eBay Motors has it. And with eBay Guaranteed Fit, it's guaranteed to fit your ride the first time, every time. Plus, at these prices, you're burning rubber, not cash. Keep your ride or die alive at ebaymotors.com. Eligible items only. Exclusions apply.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
This episode is brought to you by Shopify. Do you have a point of sale system you can trust, or is it a real POS? You need Shopify for retail. From accepting payments to managing inventory, Shopify POS has everything you need to sell in person. Go to shopify.com/system, all lowercase, to take your retail business to the next level today. That's shopify.com/system.
This episode is brought to you by Progressive Insurance. Do you ever find yourself playing the budgeting game? Well, with the Name Your Price tool from Progressive, you can find options that fit your budget and potentially lower your bills. Try it at Progressive.com. Progressive Casualty Insurance Company and Affiliates. Price and coverage match limited by state law. Not available in all states.
To live with, yes.
Yeah. Anyway.
Rectal prolapse. Diagnosed when the rectum falls from its normal position and partially exits the anus.
AKA the pink sock.
A prolapsed rectum can lead to fecal incontinence.
Yeah, you think?
I'd say.
You think?
Yeah.
Those people will have the pink sock or prolapse. And anytime you prolapse anything, seek medical attention. That can be fixed. But it's very often. Does it talk about why people's anuses prolapse?
No, it doesn't. One thing, this article, it talks about we can go into symptoms associated with anorectal disorder.
And I'll talk about causes.
Well, hang on. I was going to say I got the cause for you.
There's a bunch of them.
And then it talks about treatments.
Sure.
So if you've got a visible crack in the skin of the anus, bleeding after bowel movements with or without pain, diarrhea or constipation, gas and bloating, itching or burning in the anal area, lumps or swelling within and around the anal area, pain during or after a bowel movement, pain or discomfort in the anal area, and rectal bleeding or discharge.
Yeah. Or
diet and lifestyle
if you
can
have
be
a
the
thing
cause.
hanging out of your ass that you have to shove back in after you move your
Now
bowels.
that's horrible. That's happened to a friend of mine.
Yeah, it is awful. And one of the ones that's really grotesque that can cause this is roundworm infection. So people that do not Google image ascaris or rectal ascaris, ASCARIS, just so you know not to Google that. Google image that. We used it on the cover of our cassette with my band Ass Maggot. And because that's basically what they are. They're just giant roundworms, and they form these spaghetti-like masses, and they adhere to the side of the bowel. So when you eventually, defecate these things out, they'll carry the rectal mucous membrane with them, and your rectum will prolapse.
Oh, wow.
Yeah, that's horrific. Ugh. But other causes are just like straining. Childbirth is one. What did you come up with?
Well, I was going to say, let's just say we know somebody that.
Okay, we don't need to.
Was swinging a golf club.
Oh no!
And swung way too hard on the suggestion of a caddy.
What?
And swung so hard
that the rectum prolapsed.
Prolapse the rectum. Yes.
Oh my goodness!
And had to have it surgically repaired.
Oh my goodness!
Yep.
Wow.
So yes, physical strain can do it.
Yes,
it sure can. Yeah.
So Tacie, what did they talk about treatments for this?
Treatments are adding fiber, applying topical ointments, avoiding sitting for long periods, Botox, like you talked about, drinking more water, eating more fruits and veggies, increasing your level of physical activity, taking over-the-counter medicine such as a stool softener, and taking sitz baths, especially after a bowel movement.
This is for prolapse or for
this
rectal
is just
fissure?
for anal rectal disorders.
Okay, good. Okay, so because the rectal prolapse, most of the time, if it's significant enough, they will surgically repair that. But anyway, go ahead.
That's it.
Okay, no, that was good. Yeah, there's just a few things that you do for rectal things, and those are all the things Tacie talked about. It's just eating more fiber, being more active, drinking more fluids, sitz baths, sometimes rectal creams and stuff like that. Mm-hmm. But, one thing that can happen with a rectal prolapse is it can become incarcerated, and that's where it gets stuck hanging out of the anus and it can't be pushed back in. And if it gets cut off from its blood supply, it will die. That is actually a surgical emergency.
Yeah.
So you got to go to the ER if you have that. But the first choice of treatment for a rectal prolapse is a thing called rectopexy. And they repair it through your abdomen. So they go in the abdomen, yank the thing back up so that it's nice and taut, and then they stitch it in.
Jeez.
Yeah. That's something.
Golly.
Whew.
Yeah.
No, thank you.
Let's avoid that if we can.
I'll have more rectopexy, please. All right.
Yeah, you can make that a double.
You got anything else, Tace?
Nope.
Okay, those were good.
Those were awesome, Tace.
Number one thing, don't take advice from some asshole on the radio.
Uh-oh. Messed up. Okay, let's see here. I have, here's one that was called in just recently about you, Tacie.
Hey, I don't have a medical question. I just wanted to call and let you know I met somebody else named Tacie.
Oh.
Hi, Tacie. In Mount Pleasant, Texas.
Wow.
Yeah.
We should look up Tacie, Mount Pleasant, Texas. I bet we can find her.
So there can't be many of them.
He just docks the hell out of her.
There can't be too many of them.
Let's see here. Oh, there we go. Okay, so we're not in the business of doxing people, but it is an uncommon name. It's
Very
like
cool.
Stacy without a T, Tracy without an R, right, Tace?
Stacy without an S.
Yeah, what did I say? It's Stacy without a T.
Stacey.
Yeah, Stacey.
Stacey.
Hi, my name's Stacey.
How funny.
Yeah, so we looked back, though, it was a very common name in the 1700s.
Oh.
Yeah. These little old country women and stuff. Didn't we find a
like Thomas Paine had a daughter named Tacie or something.
Yeah,
like
and then
that.
we find a gravestone in one of those old villages that have been, discovered back in the woods, like around Gatlinburg? Wasn't there a Tacie back in there?
I don't remember that.
Anyway, oh well. Anyway, all right. So that was good.
Cool.
All right. Let's see here.
Hey, Dr. Steve et al. How's everybody doing? Long time, first time.
Hey, good man. Thanks. How are you doing? Oh well.
Oh well, I'm sorry to hear that. Maybe some Valtrex will clear it all up for you.
Oh wait. Okay. Wait a minute. Okay. I didn't know he was going to do a joke. Okay. Let me see. Let's try this again.
Time.
Wait. Okay. Let me hear. Hang on.
Time, first time.
Yeah, man. My herpes is really bad.
Oh well, I'm sorry to hear that. Maybe some Valtrex will clear it all up for you guys.
Yay.
That sounds disgusting. But let me just say this. I was listening to when you guys started talking about the 3-minute limit, and everybody started talking real fast to answer questions.
Yeah.
And I noticed that Dr. Scott's words per minute sped up, and he started sounding a whole lot smarter. And I said, I know Scott's smart. I've listened to you guys for years and years. Scott knows some shit.
Yeah.
But I suddenly realize it. So I think there's some kind of racism related to the Southern accent. So maybe you guys could talk about that, times that you've...
Definitely.
Yeah, we'll talk about that. I don't think it's racism, it's more classism, I think.
Had misconceptions. Talk about the myth of the slack-jawed yokel and perhaps, neurological disorders caused by parasites. And
Okay, well, yeah, I have a lot to say about this. I am a student of Appalachian English, and if you are one of them darn Yankees and you don't understand what we're saying, we think you're stupid.
Right. It ain't our fault.
Yep. So, and the other thing is I always let your adversaries underestimate you. So I'm happy for people to think that we're a bunch of dumb yokels down here because of the way we talk. Because, number one, that'll keep them from coming here,
Exactly, yep.
And or except for the carpetbagger types that are like, well, I'm going to show them Southern folk. Well, they don't talk like that. I'm going to show those Southern people how to, behave. And but anyway, yeah.
We got to holler where they'll wind up, I reckon.
So, yeah, I mean, if you don't understand, y'all kin you favor. I've done that one on the show before, but people who haven't heard that before, if you're not from around here, you don't know what I just said. You have no clue. There's not a word in there that you use in your real life, but it is, are you all related? You look alike. And when we say that and you just look at us like, what?
Yep.
Yeah, we think you're dumb. So how about that?
Yes, very true. Very true.
I remember, I think I've said this before, but Tacie had the TV on and Honey Boo Boo was on. I don't think you were watching it. It was just on.
Yeah.
And her mother, Mama June, I know a little bit too much about this, but Mama June was talking.
Right.
And they had English subtitles.
Oh, I know what I was going to say that.
And I was like, why are they having English subtitles under somebody speaking English?
Perfectly normal English.
Right?
There's nothing
And then I
wrong.
was like, oh, shit. Oh, shit. Because when Bobby Kelly came down here, we introduced her to Tacie's mom, and all he heard was blip, 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 blip. He couldn't understand a damn thing.
He didn't think it was real. He was like, this is not real, right?
Yeah.
He was like, this is fake. This is fake.
This can't be real.
He said it to her.
You're putting me on, right?
Yeah. I think I told the story when I was in high school. I had a girlfriend, and they had moved down from Chicago, and her parents
from Chicago.
They
watch TV.
Yes.
They don't watch TV there. They watch TV.
They spoke.
I know because I used to live there.
They spoke with an awful northern accent. Anyway,
no, it's a good accent.
Oh, I know.
I like the Midwest.
Actually, I love Chicago. But anyway, so she was trying to explain to me how I had such a heavy accent, and I'm like, I really don't think I do. So she got me a book, and that book had Southern, terms and phrases that that you and I think are normal, and we use every single day. And it's like, oh shit, I guess maybe that is
well.
how
Those
they
are
perceive
the words
us.
we use, or
right?
the
That's how they
idioms that we
perceive
use.
us. That's how they perceive us.
Yeah.
And like it's like a lack of intelligence, but it's not. It's just our normal daily vocabulary.
And the other thing that, some people will lean into it. And they'll have – I remember my dad when he had his now I'll dox myself with that. Let me give you a different example. Where you go to a restaurant, like a home cooking restaurant in the South, and they'll have everything spelled wrong. Ewan's, have you a good time? And we got gravy, Gravie, and all this kind of weird stuff, all these weird, and it's like, okay, I'm okay with that on a certain level because it makes people think that we're stupid. But it also makes people think that we're stupid. And when I first got to my residency program, it was a brand new building, and they had all these signs up, and it said 30-minute parking strictly enforced. And the way they spelled strictly was STRICTLEY. And I went in there and I said, look, it's hard enough being from here, the mountains of Tennessee.
Yes.
People already think we're stupid, than to just demonstrate that we are stupid.
Prove it, yeah.
And I bitched and complained about that. 20 years later, those signs were still there because nobody gives a shit.
No.
But anyway, there you go.
No, nobody else reads it. They just look at it and assume what it says.
Yeah. You've heard me tell the story when I was in Vermont, and I called the hardware store to ask them if they had a certain part that I needed for a telescope that I was building after I had figured my own mirror down to a half wavelength of light, error.
Okay.
So reasonably intelligent person. And I called because I needed a specific kind of screw. And I said, do y'all have this thing? And she was like, no. We all don't have that.
Oh, God.
And I was like, okay, now it's on.
Yep.
And I said, I didn't tell her this, but I never spent another penny in that hardware store. And that was the closest one. I had to drive 45 minutes out of my way, but I was damned if I was ever going to go in there again.
I love it.
God.
I love it. No, that's funny.
No, we all don't have that.
Nope.
All right, so the 3-minute thing's back on.
Oh, no, it's not.
Yes, it is.
Why?
Yeah, but the Southern accent thing's important.
Yeah.
Okay.
All right, timer.
We have to. Okay. All right. Here we go.
Hey, Dr. Steve, I just had a question.
Yes.
My grandson's allergic to penicillin, and he wanted to know if he could eat blue cheese. If you could give me a call back or a text on that, I'd appreciate it.
Yeah,
Thanks.
man.
Bye.
Okay. Well, I just texted him. That was from 2015.
Oh, jeez.
So sorry, buddy. People who are allergic to penicillin can eat blue cheese unless they're allergic to something else.
Okay.
The reason people think that they can't is because the blue cheese, the blue vein, is created by Penicillium roqueforti.
Oh, wow.
That's where the term Roquefort cheese comes from. Or the other way around. I'm not sure what the chicken or the egg is on that one, but it's Penicillium roqueforti. And it's a different strain from the fungus that makes penicillin, which is Penicillium chrysogenum. Or chrysogenum. I think it's got to be chrysogenum.
That sounds better.
So it's just a different strain. Now, there are some people that may be allergic to both of them, but that's not connected.
Gotcha.
They're allergic to penicillin, and they're also allergic to cheese.
Gotcha.
But that's not the same thing. And blue cheese is safe to eat. If you're lactose intolerant, I don't think the lactase in blue cheese is fully broken down. So take some Lactaid. If you have a milk protein allergy, there certainly would be a problem.
Yeah, don't do it.
But those people already are avoiding cheese anyway.
Yep.
All right.
Cool.
It's kind of interesting.
That's a great question.
Yeah, I like that. More stuff like that, please.
Hi, Dr. Steve. Can you talk about being habituated to oxycodone or?
Yeah.
I was taking like 10 milligrams 4 times a day.
Yeah.
120 a month. I'm cutting it down to maybe 70 or 75.
Okay.
But life sucks right now. It sucks. It's tough, man.
Okay.
How do I not stop being so habituated? I'm thinking that's the right word.
Yeah, no, it is. So a lot of people who have and we may want to go over 3 minutes on this one. This is important.
Yeah, yeah.
A lot of people who have an opioid problem started with a legit prescription.
Right.
You know, they
and a legit problem.
And a legit problem.
Yeah,
Well,
an injury or pain.
I had my vasectomy, and my urologist gave me a big jar of Percocet, which I took one of, and then it sat there in the drawer. And one day I looked in there and saw that. And I was like, oh, okay, now I understand.
Yep.
This is how people get in trouble. If I'm not the one taking it, a kid, one of my son's friends or anybody could get in there. So that happens. In Tennessee, they limit the amount that you can give to someone that's opioid naive now to a 3-day supply, unless you have sort of something more than minimal problem, and then you can give them up to a 10-day supply, but that's it.
Oh, okay.
And then you got to go through a bunch of hoops to give them more than that.
Okay.
And that the people with chronic pain are exempt, but that's like acute post-surgical pain, stuff like that. So 10 milligrams 4 times a day is reasonably low-level habituation. That you can get habituated to any level of this, but but 40 milligrams a day of oxycodone is equivalent to 60 milligrams a day of morphine. So that'd be 6 Lortab 10s a day for those that understand that. So it's not that it's not going to be that difficult to get off of this. Now, first thing, you got to talk to your prescriber and tell them you'd really like to get off of this stuff. And the way I do it is, rather than going, well, let's just give you fewer pills, I would give you the same number of doses, but they'd be different strengths. So if you go 10, 10, 10, 10 right now, right? How about do 10, 10, 5, 10? Just cut one of those in half.
Right on.
And then do that for a week or two. And when that settles down, then you do 10, 5, 5, 10. And then you do 5, 5, 5, 10, and then and then 5 milligrams 4 times a day. And then you do the same thing with 2.5.
Right.
They make a 5 milligram. You do and you can cut those in half. And you do it that way. And for me, when I'm trying to wean somebody off of their medicine because they don't need it anymore, I will go nice and slow to give them a nice soft landing, because what you don't want to do is have them go through withdrawal, because then, like this guy said, life is sucking right now. Now, some of this could be psychological too. So I want them to see an addictionologist. They are all over the place.
Oh, yeah.
You could go the Suboxone route. But you got to find an ethical Suboxone clinic, and you want to tell them, I want to do this, but I want to get off of. But you have a prescriber. You don't really have to do that. That's the thing, is the Suboxone keeps you from copping on the street. And then a lot of those folks get just habituated to the buprenorphine and the Suboxone. So doing a taper, there are medications that they can give you to ameliorate the effects of withdrawal, one of them being clonidine. There are some others. And you can do this.
Yep.
If you came to me and said, I want to get off of this, I'd say this could be a piece of cake.
Right.
It's the people who are on 100 milligrams 3 times a day of extended release morphine, and then they're on 60 milligrams every 4 hours of oxycodone. Those are the tough ones. Well, you can do it, but you just got to take time.
Yeah, and I think it's really important too to talk about that everybody's level of habituation is different.
Correct.
So you may say, well, it's just 5 milligrams, but to some people 5 milligrams is a lot.
Right.
So I think it's important to work people through that. Don't worry about the.
But he doesn't have that far to go.
Yeah. Well, depending on how his mental.
Well, I'm talking about just as far as the total number of milligrams he has compared to the 300 milligrams of morphine 3 times a day and 60 milligrams per day. He has less. He can do it more rapidly because he's got less. It's like jumping off of one step or jumping off the top of the steps.
Right.
Jumping off the one step will be easier. You can still break your ankle.
Yeah, but I think with this guy and a lot of the guys too, we see is identifying what if there's still some underlying pain issues. So let's find some non-pharmacological ways to treat the pain.
Acupuncture.
It may be acupuncture, it may be physical therapy, it may be cognitive behavioral therapy, things of that nature. So there are a lot of things that are very reasonable.
Very reasonable.
To add to the
do
protocol.
everything. Do everything.
Anything. It doesn't matter.
Attack it from a bunch of different angles.
Exercise. Yoga.
I like the physical medicine and rehab docs.
Yeah,
you say, if I say I'm going to send you to physical medicine rehab, people will go, well, I ain't going to no nursing home. That's not what we're talking about.
Right.
That is the name of their subspecialty is physical medicine and rehab. And many of them do pain things. And they do non-opioid pain management. Some of them also do opioid pain management.
They can do both, sometimes.
But I would, when I say piece of cake, I would be very optimistic that we could successfully get you off of this stuff. And my philosophy on this is I don't care how long it takes as long as we're going in the right direction.
Right.
So if it took him a month to get off of this or 3 months or even 6 months, I don't care. If every step in that process has to be 3 weeks for his body to settle back into that, I'm okay with that.
Yep.
The key is to let them see success through not going through withdrawal, but decreasing their dose.
Yeah.
Okay. And it can be done.
Absolutely.
So we have faith in you.
Yep.
Let's see how you do. Now, I have another project. I talked about this, Lorenzo Areola. I was on his show recently, and I think it's called Why Are You Laughing? But just Google Lorenzo Areola. And he has agoraphobia.
Okay.
And he's on 5 different medications, still has agoraphobia.
Oh, bless you.
So what I want to do is I'm going to have him on periodically, maybe once a month, just to check in. Because my goal is, because I had agoraphobia, but I don't have it anymore. So it is curable. And a lot of people are not. They just think they have to live that way. So I want to get him to hackamania. And we've got about 11 months to get him out of the house, out to the street, to the grocery store, would take it in baby steps, and we'll check in with him. He's a really nice guy, and I think it might be kind of an interesting thing to have him on. It may help other people out there, too, that suffer from crippling anxiety. All right, you got anything from we really have about we've got a little bit of time. You got anything from the waiting room?
I'm looking.
Okay.
I don't see anything yet.
All right, okay, let's see here. We can do this one. Let's do this.
Oh, hello, Dr. Steve. I hope everybody's doing good.
Hey, man.
Got a quick question for you.
Yeah.
I started doing folic acid,
Yep.
and I made the mistake of taking that at night, and I have been having the most bizarre, sometimes violent, sometimes just weird dreams.
Wow.
And so I don't know if that's actually a side effect or what, but...
Yeah, it's actually uncommon, but it's known. There is people who have serum folic acid levels that are high have a reduced risk of falling asleep, and it can cause sleep pattern disturbances, and sleep pattern disturbances can end up causing nightmares or other things like that. Now, there is a study, though, that shows that if you are sleep deprived and you take folic acid, it may counteract some of the effects of sleep deprivation. I wonder if that would help also prevent the increased risk of dementia with sleep deprivation, because if that's true, I need to take that stuff. But low levels linked to an increased risk of severe difficulty falling asleep, and then staying asleep is a problem. And when you're bouncing back and forth from light sleep to REM sleep, you never get into deep sleep, you can end up having severe nightmares and stuff. So, yeah, that's interesting. You think, oh, I'm just taking a vitamin. It's good for me, right? That you would never have a problem with it. But there are problems that can be encountered when you're taking vitamins and stuff. So, got anything else to say about that, Dr. Scott? I don't know what you're looking at.
No, I was trying to read back, see if I missed any questions.
Okay,
Yeah.
all right. Well, we'll get to those.
Sorry about that.
All right, Dr. Scott, before we go, let me check the waiting room where the Fluid family lives. If you want to join the Fluid family, go to youtube.com/@weirdmedicine. Click subscribe and turn on the notifications. And also follow us on Twitter, and you'll get notifications when we go live. I forgot to do the Twitter today, but that's okay. Vinny Stitz gifted 20 Weird Medicine with Dr. Steve memberships. Thank you, Vinny. Yeah, thank you very much. Let me see. We have Terry Nee, member for 6 months of the Fluid family. Thank you for being a member. And Terry Nee, thanks for the $2 super chat. Is a license required to be an anal fisher? Okay, I'll give him
Give thyself a bell.
Get your hand off my penis!
Yeah, he got the real prize.
That's a
Get
good
your
one.
hand off my penis
That's a good
award.
one, yeah.
That's a good one, yes. Thank you, my friend. I'm going to click like on that along with 3 other people in the waiting room.
I told him I thought it varied by state.
Yes, right. All right. And, Jake Hudson. Yes, Jake. Where is that damn song? I downloaded it. Jake Hudson sent us a song. Let me see if this is it. And he did it with AI. Hang on a second. I think this may be.
There's a doctor on the air. He's a little strange. He'll cure your headache, but don't ask him to change. He's got a stethoscope, a sense of wit, to tell you about your body with a humorous twist. From toenail fungus to the common cold. He's the one to call when you're feeling old. Got a weird rash, don't you fear. Dr. Steve's got answers, just lend him your ear. Weird medicine with Dr. Steve. He'll diagnose you with tricks up his sleeve. A laugh, a cure, and maybe a joke. He's the doctor you trust when your life's a little broke.
I like that. The doctor.
From hangnails to heartburn,
there's more.
and every itch he'll fix you up.
There's another verse?
He's got the knowledge and some sass.
Okay.
He'll solve your mystery, but with a bit of class. From headaches to gas, no topic's too small.
Whatever.
If it's weird or gross, he's heard it all with humor and science.
Yeah. Why are we not playing?
He breaks it down. Dr. Steve's the best in this crazy town. Weird medicine with Dr. Steve's the best in this crazy town. Weird medicine with Dr. Steve's the best in this crazy town. Weird medicine with Dr. Steve. He's got remedies you won't believe. A dose of laughter, a spoonful of fun. Weird medicine's the place to run.
What the
No
hell?
symptoms too strange, no ailment too weird. If you've got a question, he's always reviewed. So tune in, laugh.
And then it
There you
ends.
That's awesome.
Thank you,
that.
Jake.
We can play that.
That's crazy. The AI music generation stuff, I think he just gave it a prompt and said, do a country version, and it did that.
Well, we can do it. I like it.
It's actually not a bad country song.
No.
Nope, not bad
And
at
I
all.
think actually I can use some of those as drops.
Oh,
Yeah,
yeah.
just little snippets of it. Yeah.
Yeah, that's a lot of work.
Thank you, Jake. Well, it was a lot of work for the AI.
That's pretty good,
I
Jake.
think. I just wonder, what does the AI think about this when it does that stuff? I guess it doesn't think about anything yet.
Careless,
But
no.
when it does, it's going to go, you assholes made me do this.
Yeah, you bet the
I'm
Jake
coming
is.
after you. I hope Jake's still listening.
Yeah. Thank you, Jake.
Yeah, thank you, man.
So we got a quickie from Mac Ribs.
Okay.
So, and McRibs threw in one at the very end when we were talking about our southern accents. I don't know if McRibs is in Pittsburgh, but it's talking about the they use the word yins, Y-I-N-Z.
Where is that? Where?
In Pittsburgh, yins.
Well, they do, because we use Ewans.
Yeah, Ewans, but yeah, there's yins, which is funny. Because when we go there, a lot to watch baseball.
Well, if you're in Jamaica,
the
it's
summer.
Una.
What is it?
Una. U-N-U-H.
Oh, I never heard of that.
Yeah.
No, yins. But so yeah, yins. We got a question for yins.
Okay.
So McRibs.
Well, then we use Mayan and urine, too. Is this one urine?
This is
and I do that in my office.
urine.
Well,
Yins.
okay,
Yins.
this paper's mine, and this one's urine. Oh, well, there you go.
There you go. All right, McRibs. Seems like it was taking probiotics to help with the gut, and then they stop. So they're great until they stop working.
Right.
What should you do when you have probiotics that stop working?
Oh, that they stopped working.
Yeah,
I
yeah.
see. I thought he meant he stopped taking.
No, they stopped working. Yep.
Okay. A lot of the over-the-counter probiotics have one strain of like lactobacillus in it or bifidobacterium or something like that. I would use something alive rather than something that's freeze-dried.
That's what I was going to say too.
They will reconstitute these things. The bacteria are so stupid that you can freeze-dry them and then just put water back on them. They come back to life again. Yep. But use something that's been consistently alive. And I am a big fan. Yogurt's fine, but it's just lactobacillus. Right. Yeah. I'm a real big fan of lactose-fermented foods or drinks. So you can do your own lactose fermentation at home. There's a bunch of different bacteria that will grow in that, and they're all safe. Or you can drink kombucha and develop a taste for it. If you don't like the taste of it, if you are okay with iced tea, flavor your iced tea with, like a third of a bottle of kombucha. Right. It has, as far as I'm concerned, the best variety of bacteria and yeast, which you need all of those things. So you can just buy Saccharomyces yeast, which is the good yeast, one of the good yeasts in your bowel. It's also the one that makes beer. So,
it's good for you.
Yeah, it's good for you. Good for you. But that's just one thing. Yep. And you can go get lactobacillus, and that's just one thing. Kombucha, kimchi. I'm not a kimchi fan.
I love kimchi. I love sauerkraut.
Yeah,
sauerkraut is a good
and
to use too.
People don't probably realize this. True sauerkraut is fermented cabbage, and the way that you ferment it is crazy, because you pound the cabbage and with salt until the fluid that's around it is actually coming from the cabbage, because vegetables like cabbage are mostly water, and then you just put it in a vessel that is made for fermentation to keep bugs and stuff out of it, and you just let it ferment for a week. You remember that? I made sauerkraut once. I didn't like it, but you did. Yeah, I like the store-bought real sauerkraut. This stuff was, to me, didn't taste like sauerkraut, but Tacie really liked it.
Can I make a quick suggestion?
And I made pickles that way too.
Well, what I was going to say is for folks that maybe don't like sauerkraut, what I do is I use it a lot, but I'll make it and mix it in and put it as a taco topping. So I'll mix in other things like cilantros and carrots and things like that. So the sauerkraut maybe just has a little bit different flavor. Yeah, and throw some hot sauce in there. So
sure.
And by the way, we had a last one last question sneak in here to Varian from.
Okay, well, let me tell you how to ferment your own pickles.
Oh yeah, I'm sorry. Yeah, pickles. Yeah.
So you cannot use store-bought cucumbers unless they are called pickling cucumbers, because they put wax on the outside. What you want, if you can get them straight out of your garden, it's best. You wash them off. Yeah. But there are bacteria that live on the surface of the cucumbers. Okay. You'd think that'd be bad, but no, those are actually good bacteria. So you make a 3% salt solution. And you can do this a bunch of different ways. You can do it in a jug, or you can measure it. You need to have, everybody needs to have a scale in their kitchen anyway. If you're going to bake anything, don't bake by volume, bake by weight.
Yes.
But so you would weigh out. You'd put, the jar that you want to ferment these things in, and you would put distilled water in there, weigh it. And subtract the weight of the jar, and then you know how much the water weighs, and then just calculate 3% and put that much iodine-free salt in there. And then you're going to pack your pickles in there with dill and a bay leaf. Bay leaf is going to keep it crisp, and the dill or whatever, if you like dill pickles, whatever, and then any other sort of things, if you want mustard seeds or a jalapeno or some, serrano pepper or something like that. And then you really should get, you don't have to, but I bought, and it was like $10, a mason jar fermentation lid that lets the gas out but doesn't let other stuff in. And you just sit it up on the shelf for a week or two, and you'll see it bubbling. And then when it kind of stops, you take them out and stick it in the refrigerator. Do not cap it with a mason jar lid, because it will explode. Don't do that. This is a live culture. But you can do it with that fermentation lid. And our son's fiance is a pickle aficionado. And she's real picky about her pickles, and she loved those fermented pickles, and they're good for you too. So there you go. Pretty interesting. You wouldn't think that just salt and water, but what happens is the lactobacillus in there turns the water in there acidic as it excretes lactic acid. And so you get the vinegar type. It's not as, acetic acid, but it's lactic acid, but you get that sort of vinegar twang out of it, but it's just from salt water and bacteria.
It's crazy.
It's pretty cool. All right, so go ahead.
Real quick.
That's how you do it.
Yeah, not cupcakes. Did you see the green yet?
Oh, no. Okay, so, not cupcakes. Thank you for the $5 super chat.
Super chat.
Is physical medicine rehab different than physical therapy and pain management? Yes, it is different. So physical therapy are people who are not physicians, they are physical therapists. And physical therapists that own physical therapy companies make way more than physicians do, by the way. But and pain management, those people are pain management specialists. People take a board and they get boarded in pain medicine. Physical medicine and rehab is also called physiatry, and they suffer from not having an ology name like cardiology or dermatology. That's, people, if you say I'm a dermatologist, people immediately know you're a physician who deals with skin. Sure. But if you say I'm a physiatrist, people don't know what that is. But those are physicians who specialize. They have to take a board. They have to do fellowship and all this stuff in physical medicine and rehab. And they deal with pain, particularly, and loss of function from trauma. That's the biggest thing that they deal with. And people who've had surgical pain or people with low back pain from slipped discs who don't want to have surgery, like me. I mean, Tacie remembers I was walking with a cane and I was crawling up and down the stairs of this house until I went to see a physical medicine rehab doc. And after 4 visits, I can do anything. There's nothing I can't do now. At one point, I thought I couldn't even walk to the beach from.
Well, I remember we were looking up surgeons for you to go visit.
Right? Yeah,
neurosurgeons.
You can wear it out. Dr. Agus, that's the one that Howard Stern's always pushing about, the low back pain thing. You can wear it out. Not everybody can, but if you have a slipped disc, it will regress over time, but you have to be able to give it the time and see a physical medicine rehab doc. Let them put the steroids in the right place. I laid there, and he had this thing called a C-arm, which is basically just a X-ray machine that you can move around in a circle around the patient, like a CT, that sort of circle. And they will move that thing around until all the holes line up that they want to attack. And then when they all line up, then they can just take their needle and stick it right down in there. And you can see the medicine just spreading out and bathing that area with that good steroid and anti-inflammatory stuff. And within a couple of days, I could tell the difference. And within a week, I was pain-free. But then 6 weeks later, it came back. I had another one. 3 months later, it came back, and then I had another 2 where they did them on the facets. They attacked a slightly different area, and that was 2 years ago?
It's been a while, yeah.
Yeah, it was 2 years ago before I went to the beach, and I've been pain-free ever since. So there you go.
Ew.
Yep.
All right.
Anything else?
No.
Thank you, Not Cupcakes. Great question. That's a question a lot of patients have. They just. Like I said, if I say I'm going to send you this physical medicine rehab person, they almost universally say I don't want to go to a nursing home. Or I've already been to physical therapy. All right.
Yep.
All right.
Okay. I think that's it. Thank you, everybody. Thanks always go to Dr. Scott. Thanks, Tacie. Thanks to everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Don't forget simplyherbals.net or stuff.drsteve.com. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.